Hi, welcome to the DNPAO webinar series. I'm Janelle Gunn. I'm really excited that you all have joined us this afternoon as we restart the DNPAO seminar series. For those of you who don't know, DNPAO is a division of nutrition, physical activity, and obesity at CDC. So we're really excited you're joining us today. We will be focusing on the recently released 2020 to 2025 Dietary Guidelines for Americans. You may hear some of our speakers refer to these as the DGAs. I'm Janelle Gunn. I lead the Office of Policy, Partnerships, and Communications in DNPAO, and I'm joined today by three outstanding speakers who will highlight different parts of the dietary guidelines. The seminar today will focus on the 2020 to 2025 Dietary Guidelines and how it impacts your work. With three outstanding speakers for you today, who I'll introduce. So first, we'll have Dr. Heather Hamner, a health scientist in DNPAO. She will focus on newly added recommendations for children 0 to 2 years old. She will be followed by Dr. Jennifer Seymour, a senior scientist and policy advisor in DNPAO. She will draw out some of the key recommendations, including recommendations to limit added sugar. Lastly, we are pleased to have Chris Mornick with us. Chris is a nutrition coordinator for the Washington Department of Health, one of our STAN recipients, the State Physical Activity and Nutrition Program. And she will share a field example of an application of the dietary guidelines. We'll focus on food service guidelines and creating a nutrition policy. So to quickly kind of level set before we jump in, and I hand the virtual microphone over to our speakers, I wanted to just set a little bit of context about the Dietary Guidelines for Americans. So as a result of the National Nutrition Monitoring and Related Research Act of 1990, every 5 years the Departments of Health and Human Services and Agriculture collaborate to develop the Dietary Guidelines for Americans. Each new edition builds on the previous edition and covers the preponderance of evidence and results in guidelines for the public. These DGAs serve as federal nutrition policy. So for us at DNPAO, that means the nutrition work of our recipients, our SPAN, HOP, High Obesity Program, and REACH, Racial and Ethnic Approaches to Community Health, their work is also consistent with the Dietary Guidelines for Americans. The DGAs have been largely consistent over time, with each edition building on the previous edition. There is a focus on dietary patterns as food and beverages act synergistically to impact health. And the development of the dietary guidelines, there's 4 key stages. So the first is to identify topics and supporting scientific questions. The second is to appoint a dietary guidelines advisory committee to review the evidence. The third is to develop the guidelines. And the fourth is where we are now, implementation of the dietary guidelines. So this edition's theme is to make every bite count. And here's how. So the first is to follow a healthy dietary pattern at every stage of life. It's never too early or too late to eat healthfully. The second is to customize and enjoy nutrient-dense food and beverage choices to reflect personal preference, cultural traditions, and budgetary considerations. The third is to focus on meeting food group needs with nutrient-dense foods and beverages and stay within a calorie limit. An underlying premise of the dietary guidelines is that nutritional needs should be met primarily through foods and beverages. And the fourth is to limit foods and beverages higher in added sugar, saturated fat, and sodium, and to limit alcoholic beverages. Now let's start with some of our littlest consumers. I'm pleased to hand over the Zoom spotlight to Dr. Heather Hamner. Heather?
Thank you so much for having me. Today I'm going to focus on the recommendations that were included for infants and toddlers. And as Janelle mentioned, this is the first time that the Dietary Guidelines for Americans have included children birth to 24 months of age. So it's great to see that we have so many folks who are able to join us today. And as we start this presentation, I thought it might be fun to just see how many organizations are focusing their efforts on children birth to 24 months of age. So take a moment, answer the poll. We'll get those results probably back to you towards the end of the presentation. The Dietary Guidelines provide several key high-level recommendations for this particular age group. Today what I'd like to do is walk through each of these in just a little bit more detail, and then I'm going to conclude with some examples of how CDC is working to incorporate the guidelines into the work that we do. So the first recommendation is about feeding infants human milk for the first 6 months. Human milk is the ideal form of nutrition as it provides the necessary nutrients, the protective factors, and other immunological benefits. Human milk is unavailable. Infants can be fed an iron-fortified commercial infant formula. Safe handling and storage both for expressed human milk as well as infant formula are important, and I'm going to highlight a couple of resources that CDC has developed a little bit later in this presentation. An important thing to note is that homemade infant formula, as well as those that are improperly or illegally imported without a mandated FDA review, should not be used. Lastly, when human milk is obtained directly from individuals or through the internet, the donor is unlikely to have been screened for infectious diseases, and it's unknown whether the human milk has been collected or stored in a way that could reduce the safety risk for the baby. So vitamin D is an important mineral that supports healthy bone growth. Infants who are only fed human milk, or if they receive both human milk and infant formula, often this is called mixed feeding, need a vitamin D supplement of 400 international units per day, beginning soon after birth. For those infants who are fed infant formula, a vitamin D supplement is not needed as infant formula is fortified with vitamin D. Now, after 12 months of age, it can still be challenging to get adequate amounts of vitamin D from foods and beverages, even when consuming a varied diet. This suggests that many children may need to continue taking a vitamin D supplement, so it's best to talk with a healthcare professional. The third key recommendation is around offering infants a variety of complementary foods and beverages that meet their caloric and nutrient needs while limiting things like added sugar and sodium. At about 6 months of age, infants can be introduced to nutrient-dense complementary foods. Specifically, iron and zinc-rich foods are important during this time period. Variety and repeated exposures of foods is another component of this recommendation. Children can be introduced to multiple flavors, textures, and different food groups. And it can take up to 8 to 10 different times for an infant to accept a new food. Now, in the second half of infancy, as an infant's oral skills begin to develop, the thickness and the texture of foods can gradually be varied, but it's important to make sure that the foods are prepared in a way that's developmentally appropriate to help prevent choking. Potentially allergenic foods can be introduced along with other complementary foods. There is no evidence that delaying the introduction of these foods helps to prevent a food allergy. Introducing peanut-containing foods in the first year can reduce the risk that an infant will develop an allergy to peanuts. Cow milk products, like yogurt, can be introduced with other complementary foods, but cow milk as a beverage should be introduced at 12 months or later. So the next recommendation is about a variety of food sources. Children should consume a nutrient-dense, diverse diet that includes foods from multiple food groups: protein, vegetables and fruits, yogurt and cheese, including soy-based yogurt, and grains. These food groups provide important key nutrients like zinc, iron, vitamins A, C, D, and more. For example, iron-fortified infant cereals can play an important role in meeting the iron needs for young children. Fortified infant cereals include rice, oat, barley, and multigrain. Rice cereal should not be the only infant cereal that's provided to young children. Young children should be offered whole grains, more than refined grains, to increase their dietary fiber as well as their potassium intake. The dietary guidelines also identified several components for infants and young children to limit. There's virtually no room in their diet for added sugars. This is because the nutrient requirements for infants and young children are high relative to their size, but the amount of complementary foods that they consume is actually quite small. This means that the complementary foods really do need to be nutrient-dense and not contain additional calories coming from things like added sugar. Low and no calorie sweeteners are not recommended for children younger than 2. Foods higher in sodium should also be avoided for young children. Taste preferences are being formed during this time period, so consuming added sugars, sweeteners, or salty foods may contribute to a preference for these flavors later in life. Lastly, infants should not be fed honey, either raw or cooked in food, and should avoid unpasteurized foods and beverages, as these can contain harmful pathogens. So an important part of a healthy dietary pattern is also thinking about beverages. Infants do not need any other beverage other than human milk or infant formula in the first 6 months. Small amounts of plain fluoridated water can be given with the introduction of complementary foods, but not before. After 12 months of age, children can be introduced to plain cow milk or fortified soy beverages. Additionally, children can have unsweetened, plant-based milk alternatives. It is important to understand that these plant-based milk alternatives contain less protein than cow milk and are not always fortified with calcium and vitamin D. 100% fruit or vegetable juice can be provided after 12 months of age. If it is provided, it needs to be limited to 4 ounces a day. There are also beverages that should be avoided, including sugar-sweetened beverages, as well as those with caffeine. For toddler milk or toddler drinks, there's no clear need for these drinks, as the needed nutrients can be obtained from plain cow milk, fortified soy beverages, or nutrient-dense complementary foods. Additionally, these drinks typically contain added sugar. One of the last key recommendations is about transitioning children to a healthy dietary pattern. This table shows the healthy U.S.-style dietary pattern for children 12 to 23 months of age who are no longer consuming human milk or infant formula. I'm not going to go through this table in great detail, but you can look at it in the dietary guidelines if you're interested. I do want to point out a couple of things. First, what you'll note is the caloric intake levels range from about 700 to 1,000 calories per day. And this is about the right amount of calories for toddlers of this age group. You'll also notice that it includes a variety of nutrient-dense fruits, vegetables, grains, protein food, and oil. The pattern does not include infant formula because it's not recommended after 12 months of age. For infants who are still consuming human milk, a healthy dietary pattern would include a similar combination of nutrient-dense foods and beverages. You'll also note that as I have said earlier, there really is not a lot of room for additional calories coming from things like added sugar. So finally, in addition to the what to feed young children, the how to feed is also really important. Responsive feeding describes a feeding style that emphasizes responding to a feeding cue of an infant or a young child. The chart here shows some common signs of when a child may be showing that they're hungry or when they're full. Responsive feeding can help children learn how to self-regulate their intake, which can contribute to building a healthy eating pattern. Parents, guardians, and caregivers all have an important role to play in helping to establish these eating patterns, as young children are completely reliant on them for the foods and the beverages that they consume. So I want to turn now to talk briefly about how CDC is working to incorporate the guidelines. And I wanted to highlight a couple of resources that are available. First, we have our infant and toddler nutrition website. This site compiles information and practical strategies and tips for parents and caregivers with clear, consistent, and credible information. We're in the process of updating this website to make sure that it completely aligns with the dietary guidelines. We also have some wonderful resources on safe handling and storage, both for expressed human milk as well as powdered infant formula. All of these are available on our website for download, and the websites are listed here. Lastly, there are also ways for organizations to syndicate existing content to their own website. Syndicated content allows an organization to add CDC.gov content to their own website without having to maintain or update it. The service is free, and it can help provide that clear, consistent, and credible information. We've syndicated the entire infant and toddler nutrition site, as well as multiple breastfeeding web pages. So it's a great opportunity to go ahead and syndicate now. You can find information on the content that is available for syndication, as well as exactly how to do it at this website below. So with that, thank you for your attention, and I will pass it to Jenna.
Thank you, Heather. Now that we've had a broad overview of the guidelines and a deep dive into birth to 24 months, I'm going to cover what's left. There's a lot within the guidelines where I will only be able to whet your appetite, that is a pun intended. So in the end, I hope that this presentation gives you a reason to learn more about them. Around 85% of calories are needed per day to meet food group recommendations when consuming healthful, nutrient-dense foods, leaving about 15% of calories for other uses, including added sugars, saturated fat, or alcoholic beverages. The truth is, however, that very few people eat foods in their most nutrient-dense forms, which means they really don't even have that many extra calories in their diet. Now I want to look at sources of added sugars, saturated fats, and sodium in American diets. Sugar-sweetened beverages are the number one source of added sugars at almost 1/4 of intake, with 16% of the total specifically from soft drinks. The number two source of added sugars is desserts and sweet snacks at almost 1/5 of intake. So together, they account for about 40% of intake of added sugars. For saturated fat, the number one source is sandwiches, and the number two source is desserts and sweet snacks. Together, they account for 30% of intake. For sodium, the number one source is sandwiches, with the rest of intake spread much more widely throughout the diet. There are three major areas of the guidelines that are completely or almost completely new. The B24 that Heather already covered, and the two others that I will cover, starting with women who are pregnant and lactating. Dietary patterns for pregnant and lactating women should be very similar to any other healthy dietary pattern, just with different calorie levels. The chapter on pregnancy and lactation goes into detail on issues such as nausea, vomiting and food aversions, and cravings. It also explains that women do not need to restrict their dietary choices to prevent allergies in their children. And there is guidance for vegetarian and vegan women, guidance for appropriate weight gain, and food safety issues specific to this population. There are special considerations related to certain critical nutrients, such as folate, folic acid, iron, iodine, and choline, as well as information on consuming seafood, alcohol, and caffeine. The last new chapter provides information for older adults. The dietary guidelines defines older adults as 60 years of age or older. Older adults are more susceptible to chronic diseases, including osteoporosis and sarcopenia, the loss of muscle with age. Older adults can also have issues with chewing and swallowing, and food safety is very critical since there is a decline in the immune system with age. The special considerations for older adults include protein for lean muscle mass, B12 because the ability to absorb it decreases with age, hydration because thirst decreases with age, and older adults may react faster to alcohol, and it can have a greater effect as well. So now I want to talk about some of the implications for our work. Of the topics that are part of our funded programs, the four listed here are directly related to the content of the dietary guidelines. The food service guidelines in federal facilities that is offered as a model for states and communities to follow are based on the dietary guidelines. The guidance for lactating women can play an important role in interventions to support breastfeeding. Nutrition standards in early care and education can be written using the content of the DGA, as well as nutrition standards in key institutions listed here. There are also many resources available for professionals to use on the Dietary Guidelines website, and more will be added over time. so the link at the bottom of this slide can be very helpful for you and others with whom you work. The specific resource shown here, and I wasn't expecting you to be able to read it during this presentation, shows that the dietary guidelines can be customized for many different diet cultures, budgets, and more. By giving many examples of the kinds of foods that fit into the 5 food groups within the dietary patterns presented in the DTA. The dietary guidelines are written for professionals with the intention that they will adapt it to the populations with which they work. They discuss the broader categories of foods that are part of a healthy diet, such as vegetables. But those broad categories can be made up of all types of foods, such as chumnamor, which is used in Korean cuisine, taro leaves used in native Hawaiian cuisine, nopales for Mexican cuisine, the Three Sisters, corn, beans, and squash in certain American Indian cuisines, or broccoli used in many cuisines throughout the U.S. Whatever population you may be working with related to diet, the guidelines can be adapted to be as representative as possible. Now I'm happy to turn over the presentation to Chris to give an example from the field.
So hi everyone, and thank you, Jenna. My name is Chris Warnick, and I am really excited today to be able to share with you about our work developing and adopting a nutrition guidelines policy with Special Olympics Washington. So first, I'd like to thank our partners. Stella Norton is the Director of Health Programs at Special Olympics Washington, and Mary Pittaway is the Global Clinical Advisor for Special Olympics International. This work would not have been possible without these 2 incredible women, and I am so grateful to have had the chance to work with them and to keep working with them. So individuals with intellectual disabilities have a higher risk for chronic diseases and other poor health outcomes. Research shows these individuals are more likely to experience obesity, to smoke, to have high blood pressure, and to be inactive, all of which can lead to heart disease, diabetes, cavities, poor bone health, and other preventable conditions. And these trends mimic what Special Olympics Washington found during their 2019 health promotion screening, where 30% of adult athletes who participated in the screening were categorized as overweight and 27% as obese. Similarly, 20% of participating children were measured as overweight and 45% as obese. So in addition to the promotion of physical activity that is inherent to Special Olympics' mission, healthy nutrition is also really important for this population. The idea of a nutrition guidelines policy for Special Olympics really started with Mary Pittaway. So in February of 2018, Mary reached out to the Washington State Department of Health and asked for help increasing access to healthy options at the 2018 USA Games, which were being held in Seattle. Although it was too late at that point to make any changes to the actual food and beverages that were being served at the Games, we were able to work with the University of Washington and developed informational signage for dining halls, helping to direct athletes to healthier choices. But what this experience really highlighted was the need for a nutrition policy that would help ensure healthy options were available at all Special Olympics events. And because no Special Olympics chapter had ever done a nutrition policy before, Mary suggested that we start locally, and we worked with Special Olympics Washington to develop and adopt nutrition guidelines that could serve as a model for the broader Special Olympics community. So in September of 2018, I began working with Special Olympics Washington to lay the groundwork for a nutrition guidelines policy. Nutrition guidelines tailored for a statewide sports organization like Special Olympics didn't exist. So we kind of had to start from scratch. We used the Dietary Guidelines for Americans, the Food Service Guidelines for federal facilities, and the National School Lunch Program as our guides. The first draft of our guidelines included tiered categories for healthy, healthier, and healthiest options. These were never meant to be our final set of guidelines, but it gave us something to pilot with athletes and to determine the feasibility of implementing nutrition standards. At the same time, Special Olympics Washington sought feedback from athlete communities to get a feel for whether a nutrition policy would be supported. And the response that they got back from the community was overwhelmingly positive, with athlete input councils requesting food and beverage options that were most often healthier than even what we listed in our healthiest category of the guidelines. Despite this support, Special Olympics Washington felt most comfortable initially adopting the guidelines as an official statement, but stopped short of a policy. This actually provided more time for us to get buy-in and to develop resources before trying to get them to adopt an organization-wide policy. So after the statement was issued, it quickly became clear that additional tools, trainings, and resources were going to be needed in order to help the guidelines be implemented. So we reached out to athletes, coaches, families, staff, and volunteers to learn about their resource needs. We also worked really closely with the procurement manager and the event staff, and all of this feedback was incorporated into a 28-page toolkit. The toolkit has tip sheets, checklists, a coach's guide, and general guidance for vendors, caterers, staff, and volunteers. As we were developing the toolkit, we also needed to update the guidelines. So we removed the tiered structure and created a single set of standards which align as closely as possible to the food service guidelines for federal facilities and the DGAs. These guidelines apply across all settings, and that includes catering, vending, concessions, food ordered for restaurants, sponsorships, and donations. And in addition to the nutrition guidelines, we also included 2 guidelines for behavioral standards. These are encouraging healthier choices and promoting healthy portion sizes. Special Olympics Washington chose to make these a part of their guidelines because they recognize the importance of helping to make the healthy choice the easy choice. And further guidance on these recommendations is provided in the toolkit. So I'm happy to say that in September of 2020, over 2 years after we first started this project, the Special Olympics Washington Board of Directors voted unanimously to adopt the Healthy Food and Beverage Guidelines as policy. So now, through the many events that Special Olympics Washington hosts, this policy has the potential to impact more than 28,000 people in our state each year. So on this slide, I've listed some resources, including a link to the Special Olympics Washington Health Initiatives page. And on that page, you can access the guidelines, the toolkit, and a success story, which details the process we undertook to develop the guidelines and get them adopted. And here's my contact information if anyone has questions or wants to learn more. I want to thank everyone so much for listening, and to CDC and the DNPIO team for the opportunity to share about our work. And now I will turn it back to Janelle.
Thank you, and we're so pleased to have you join us today. We have some time for some questions and answers with our panelists. So as a reminder for all of you who have joined us today, please type your questions into this Q&A setting below, and many thanks to the extended team at DNPA. I see they've been responding to some questions just in the chat, in the Q&A box as well, so hopefully we can get to everybody's needs. So Heather, I'm going to ask you a question first, so just wanted to update you on the poll. About 40% of our participants today said yes, they're working with an organization that has some type of nutrition focus for children 0 to 24 months old. So my question to you is, do the dietary guidelines recommend 100% fruit juice or vegetable juice for children birth to 24 months?
That's a great question. So the dietary guidelines recommend that after 12 months of age, if juice is provided, the 100% fruit or vegetable juice, it can be provided, but it needs to be limited to 4 ounces per day. So it's after 12 months of age.
Great, thank you. I'm going to turn it over to Jenna next. Do the DGAs offer specific healthy dietary patterns for people who are vegetarian or vegan?
Thanks, Jill. So there is a specific dietary pattern for vegetarians that goes into a lot of detail, but not specifically for vegans. But what there is quite a bit of advice throughout the guidelines that do talk about people who are on vegan diets and give some kind of advice around it. And I think it is fairly easy to take the vegetarian dietary pattern and turn it into a vegan dietary pattern.
Thank you. Chris, question for you. It seems that in order for nutrition guidelines to be effective, you really need to have buy-in from the organization and the community. Can you tell us a little bit more about how you work with Special Olympics Washington to get buy-in for the guidelines?
Sure, yeah. So buy-in was key for us throughout the whole process, and that's part of the reason why we took over 2 years to get the nutrition policy adopted. As I mentioned, we work extremely closely with the procurement manager. So one component is to work with the people that are going to be impacted by the actual policy, but then you also need to work with the people that are going to be in charge of implementing the policy. So we developed a toolkit. We also developed a procurement tool, an Excel tool, and try to address the specific challenges and needs of the people that were going to be responsible to seeing the guidelines out. And then we worked with coaches. We had a coaches conference where we presented the guidelines and the toolkit and got feedback. So multiple points for feedback from the community.
Thank you. Heather, I'm going to head back to you. The DGAs recommend that most dairy choices should be fat-free or low-fat. Is there any specific recommendation in terms of whole milk versus low-fat milk for infants between 1 to 2 years and after 2 years old?
So for infants in 12 to 23 months, they're actually recommending whole fat. It's important for this age group to get that fat content. It really does have important implications for brain development and just development in general for that younger age group. As children transition out of 2 years of age, that's when you can start looking at lower fat options.
Thank you. Loving all the questions, so continue to put them in the Q&A box, and we'll keep going for as long as we still have time. So Jenna, back over to you. Are there specific milligrams, et cetera, for each of the nutrients, or does the dietary guidelines sort of offer more global recommendations?
So it sort of depends. So for sodium, for added sugar, for saturated fat, what you have for sodium, there are specific milligram recommendations. For saturated fat, it's less than 10% of calories in your diet, and the same thing for added sugar, less than 10% of calories is the recommendation. Now, when it comes to the various nutrients that make up a wide array within the diet, what is used by the dietary guidelines are the dietary reference intakes, and then USDA creates dietary patterns that meet those nutrient intakes. So when you're following one of the nutrient patterns, you will be meeting the recommendations for certain nutrients within the diet. That's anything from like vitamin A and C and vitamin D. But then on top of that, there are the special considerations, and that's where there will be some discussion around a certain nutrient for pregnant women. And so, yes, there are specific recommendations all based on the dietary reference intake for those individual nutrients that are described specifically within the dietary guidelines.
Chris, can your toolkit be adopted for home use as a guide for parents or special needs children?
That's a great question. So the toolkit is designed more specifically to help roll out the guidelines. And by that I mean it's designed mostly for coaches, staff, volunteers, and people in charge of procurement. But that's not to say that parents couldn't use the information as guidance. I think that we've had a lot of coaches who are also parents. So the feedback that we got on some of the sections were from parents of people who had intellectual disabilities. So it's on the Special Olympics Health Initiative's website, so anyone can access it.
Heather, you have a question about caffeinated beverage, and is there any harm in giving, I guess, a toddler over 12 months caffeinated beverage?
So caffeine is not recommended for kids younger than 2. So no.
Good answer. Jenna, you said sandwiches are the #1 source of sodium and saturated fat in the U.S. Does this include things like burgers from fast food restaurants in that category?
Yes, it does. So there are definitions within the dietary guidelines of exactly what is covered, but when they talk about sort of that sandwich category, it includes just about everything that you can think of as having sort of a top and bottom bread type thing. So that would be the burgers and just the regular sandwiches, but it also includes like anything that would be in a hoagie roll kind of thing. So it is a wide variety, and yes, it includes foods that are from restaurants and prepared products, etc.
Thank you. Chris, is the Washington Special Olympics helping other states adopt nutrition guidelines for their events?
Yeah, so we have been working actually with Special Olympics International as well as CDC to try to get the word out to other Special Olympics state chapters that are interested in the guidelines. We've done a presentation for Special Olympics North America. We've also done presentations for the Food Service Guidelines Collaborative, and we've had quite a few states reach out. So we are doing some engagement with other states around the nutrition guidelines, and happy to do more.
Thank you. Heather, do the dietary guidelines provide a dietary pattern for children birth to 24 months who are vegetarian?
So dietary patterns are only provided for kids 12 to 23 months. There wasn't a dietary pattern that could be established for kids 6 to 12 months or 6 to 11 months. But for 12 to 23 months or 23, 24 months, yes, the pattern, there is one in the appendix, so you can go and look. It does provide some information on a vegetarian diet and has more of the food groups coming from beans and peas, soy beverages or soy products. The thing to keep in mind though are some nutrients that might be lacking. So vitamin B12 coming from animal sources, you need to really think about that, as well as iron. So talking with a healthcare professional, just making sure that a child is meeting all of their nutrient needs even while still consuming a vegetarian diet.
Jenna, how do the BGAs account for different cultural dietary norms?
So overall, really the dietary guidelines talk in these very general terms because they are intended for professional audiences, and then it is assumed that because they are avoiding getting really specific about, like, this is exactly what your diet should look like, there's much more of this, here's this broad dietary pattern that includes fruits and vegetables and grains and protein, that it's really possible to adapt it for any kind of cultural foodways. And so that's really where, and that resource that I showed on my last slide, if you were to go and look at the resource page, you'll see that it shows examples for all of the different food groups of, and obviously it can't go into everything, but it goes into a lot of different ways that there are so many foods from so many different cultural foodstuffs that can be a part of this overall dietary pattern. So in some ways, the guidelines themselves that are for professionals sort of stay away from any one particular cultural diet, and instead leave that up to the people who are turning the guidelines into resources for the public. And that's where there's this ability to really adapt it to all kinds of different ways of eating.
Thank you. Chris, so working with community groups and others is key to get buy-in and understand the challenges and barriers they face implementing the guidelines. What are some of the challenges you found in your work?
Well, I think one of the primary challenges was just that although there's wonderful models out there for food service guidelines, they don't always have a one-size-fits-all approach, as Jenna was saying. So we did have to do some adaptations. And I think being patient was really important because being able to stakeholder those guidelines and being able to work with staff and make sure that our guidelines were not only appropriate, but that they were going to be feasible was really a big challenge as well. So luckily, Special Olympics Washington was just an incredible organization to work with, and we had so much support. But I think having a champion was really key as well. The CEO of Special Olympics Washington was excited about this. He wanted to make it his legacy before he retired. So I think challenges are really around finding that champion, and then a lot of the other challenges around developing guidelines we addressed. So adapting those guidelines as a model for your organization is going to be work, and then getting buy-in.
Thanks, and what a wonderful legacy, especially as it spreads across to other states. That's a big impact. When should allergenic foods be introduced to young children?
So So allergenic foods can be introduced along with other complementary foods, so it's the same time. If it's peanuts, it needs to be introduced in the first year. Research has found that introducing peanuts in that first year can help reduce the risk of a peanut allergy. For infants who are higher risk for food allergy, that includes those who may have severe eczema or an egg allergy or both. That's when peanut-containing foods would need to be introduced a little bit earlier, so 4 to 6 months. But it's really important to talk with a healthcare professional and do that with them so that we can really think through and help monitor that particular progress.
Thanks. Jenna, you have a question here. What is the daily maximum recommended for added sugar for adults? And is there anything specific for maybe an adult who has prediabetes?
Yes. So as far as the added sugar, it is in the guidelines. It says less than 10% of calories for everyone, except of course in the B24 where it says no added sugar. But I think it is important to note that in the dietary guidelines, it makes clear that this is really a pretty high number. That if you are to look at dietary patterns and what actually can fit into a person's diet for them to get all the nutrients that they need, most adults really cannot get more than 8% of calories from added sugar, and really even lower than that if you're having any excess saturated fat, or if you consume any alcohol whatsoever, all of those things take away from the number of calories you have for other foods. So it really is 10% is really a very high number in some ways, and really should be going down much lower. There isn't specific discussion of prediabetes. Really, in general, the dietary guidelines are intended for a generally healthy population, although what they will say, they just want to be clear that they're not clinical guidance, but what they will say is that doesn't mean you can't adapt, again, that same broad dietary pattern being adapted for any number of chronic diseases as well. And so there certainly is room to adapt it. But what I would say really for us when we're talking about prediabetes, then we're going to point people to our sister division and really talk about the DPP and the diabetes prevention program. And I will say I am working with them on an update to that will reflect new issues in the dietary guidelines, and I am also going to be doing a presentation with them on the new dietary guidelines in the not too distant future.
Great, thank you. I think that'll be helpful. We have a question for you. Do you have diet recommendations by sport? And then do you cover beverages at all? And do you have anything about during performance versus in general? So a little bit asking some more specifics about your guidelines.
Sure. Yeah. So we do have guidelines. I'm sorry. There's a bit of an echo. We do have guidelines around healthy beverages, but Special Olympics already has guidance for athletes more specifically around pre and post workout. So this guideline document really focused more on things like catering for Special Olympics games and events, bagged lunches, food eaten on the road at restaurants, snacks served during events, local events. So it was really more general guidance based on the dietary guidelines for Americans, and we left some of the more specific guidance around, what to consume pre and post workout to Special Olympics.
Excellent. Thanks. Heather, back over to you. With the current guidelines, what would you stress as maybe significant changes for families to prioritize that have infants and toddlers?
Well, so this is the first time we've had guidelines, so I think that's probably one of the biggest things is that we just now have this much more clear guidance for families and caregivers for kids. But I think there are a lot of things to think about. The variety and the repeated exposures for different foods and food groups, that's really important, making sure they're getting lots of different opportunities to try different foods, food groups, and then making sure that we're transitioning to that healthy dietary pattern. So as soon as children are being introduced to complementary foods, really focusing in on building that up from 6 to 11 months so that once we hit that 12-month mark, we really can start to transition to a healthy dietary pattern. And then it sets them on the path to have those good dietary patterns as they get older and can continue to follow the dietary guidelines once they're going into school and other age groups.
Thank you. Jenna, you have a question. Do the DGAs touch at all on non-nutritive sweeteners, zero-calorie beverages, that type of thing?
Yes, they do. There was a whole review that looked at both the non-nutritive sweeteners as well as the sugar-sweetened beverages, and I have to admit, it's been a little while since I looked at exactly everything that they say, but it's a little bit more just carefully worded in saying that there is some evidence that switching from sugar-sweetened beverages to those with non-nutritive sweeteners can have some impact on body weight, but that there's more of a push for healthier beverages, water, and that if I remember correctly, it's not recommended for those products. Maybe Heather can come in here, but not recommended for the use of non-nutrient sweeteners for young children.
That's correct. Yeah.
And then Heather, back over to you. I have a question about almond milk, but maybe it's a good opportunity to talk about plant-based milks and what that recommendation was again.
Sure. So plant-based milk alternatives can be used. I think the thing to note is that fortified soy beverages are the only ones that are actually considered to meet the dairy requirement for kids. So that's something to keep in mind. Oat milk would not be that. It's important to think about the protein content. It is much less than cow milk. So it's important for kids to get enough protein. They're building their muscles. They're getting big. So we want to make sure that they have all of those building blocks. And then a lot of times those plant-based milk alternatives aren't fortified with things like calcium and vitamin D. And again, thinking about the bone growth and development that's occurring, calcium and vitamin D are really critical. So that's an important piece. Does that answer that question?
Yes, thank you.
And I would just add in for adults, it's really very similar that only the soy beverages are considered an alternative for the dairy, and the other types of plant-based milks are put into sort of an other beverage category and not considered a replacement for dairy products.
I have one thing to add.
That's great. Go ahead.
It's also that it needs to be unsweetened. And I think that's a biggie, because it becomes a sugar-sweetened beverage at that point. And so having not plain cow milk, so not flavored cow milk, unsweetened plant-based milk alternatives, so that's really important. Make sure that we're avoiding those added sugars.
Thank you. Well, on behalf of the Division of Nutrition, Physical Activity, and Obesity, I'd really like to thank the panel for joining me today. So a virtual applause for them, and especially for Chris Mornick from the Washington Department of Health for joining us for the seminar. We will be doing an additional seminar or two throughout the year, really trying to bring some of the science and the practice to you all. So I really appreciate everyone's time today for joining us, and we look forward to talking with you all soon. Thank you.